Okay, this was the agenda that you saw, and I'm going to go through a little more specifics, obviously more specifics than last week this time. And I'm going to be doing another webinar next Friday, same time. And at that point, the blackout period will be over and I can get into even more specifics. Let me start off with Medicare updates. And Clau, I'm not sure if people are muted, but if you could mute everybody.
They are all muted, Mike.
Okay, great. First of all, Medicare Part B premiums, which most people pay, unless they're eligible for partial or full Medicaid, they are $185 this year per month. And then IRMA, which is I refer to as a Robin Hood tax, will be piled up on top of that. We don't know what 2026. You see numbers like 200 to 210, 215 in that range. And then IRMA taxes and Part B and IRMA brackets for 2026. Those of you that are subject to IRMA, those will be announced usually by mid-November. But of course, with everything going on with the budget and reconciliation, blah, 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 that may be delayed. Medicare supplement plans, which I have.
Sorry, excuse me. You're really scratchy. Is that?
Oh, okay. Then thank you. Thank you. I'm going to be, and if that is, put that in the chat, and if hopefully you can hear me better now. I'm going to be closer to the microphone.
Not really.
Well, sorry about that. That's a bad internet connection. Let me try to turn some things off here, but thank you for telling me that. Okay, Medicare Part B, and by the way, the recording will be a lot fresher because I'm recording it from my laptop. Medicare supplement premiums this year, $185, maybe $200 to $210 next year for Part B. Medicare supplement plans, they're predicting increases of about 10 plus percent. Some people may see more of an increase based on age or location or gender. Us guys, our premiums go up faster because we have more claims than comparably aged opposite genders. And as you get older, you pay more. But it's still, in my estimation, a great way to reduce not only your financial risk, but the risk of not seeing the doctors and hospitals that you want to see when your time comes. Prescription drug coverage in Medicare is changing a ton. I'm going to go through that, not only for standalone Part D drug plans, which match up with a Medicare supplement plan, but also prescription drug coverage under Medicare Advantage plan. And because of the amount of change, I'm making changes in how I can support you. And I'm asking everybody to meet me halfway. And then I'm going to go through how to update your prescription drug coverage during open enrollment, and then question and answers on this webinar. And again, nothing personal, but I'll have open office hours until 2 p.m. today. And if I'm not coming through, just let me know. All right, Larry, today's objectives. We talked about open enrollment timing. October 15th is the first day you can enroll. I'm going to go through some refreshers. I'm also going to talk about the highlights and lowlights. I already mentioned Medicare supplements and the changes in Medicare Advantage plans, and then some unknowns. There's a lot of unknowns. And also we'll cover what you need to do now to get ready for 2026, which, open enrollment, as you'll see, it's less than 2 weeks away, or just about 2 weeks and a couple of days. So October 1st, which is 5.5 days away. That's when the blackout period is over and I can talk specifics. December 7th is the last day of open enrollment. January 1st through March 31st are the times when those of my clients who are on Medicare Advantage plans, if they If they want to change your plan, and there's a lot of changes in formularies, in providers, and in the plans themselves, which I'll talk about, you can change your plan from January 1st to March 31st. You can't change your your standalone prescription drug plan, but you can change your Medicare Advantage plan. Now, Medicare supplement plans, you can enroll initially any day of the year. Okay. Now, that initial enrollment period starts when you enroll in Part B. You may work beyond age 65 and be on an employer plan, but once you enroll in Part B, then you have 3 months afterwards to enroll in a Medicare supplement plan and not have to answer medical questions. After that, you have to pass underwriting, answer health questions, and pass underwriting. But this is really a key thing this year, because there are a number of Medicare Advantage plans that will be terminated, or you will be mapped into a different plan for 2026 if you do nothing. And when your plan goes out of the market, you are eligible to, it's called guaranteed issue. You can enroll in a Medicare supplement plan. So if you're not happy with the Medicare Advantage plan, or you want to reduce your out-of-pocket medical expense risk, if your plan ends, that may be bad, but on the other hand, it would allow you to enroll in a Medicare supplement plan, and not necessarily just a Plan G. There are less expensive plans than Plan G. And what that would enable you to do is see any doctor anywhere in the U.S., any Medicare supplement plan. Okay, Medicare refresher, if you've worked 10 years, or your spouse has, or your ex-spouse, if you were married for 10 years and didn't get remarried, you've already paid for Part A, okay? Part B, it's at $185 this year. Like I said, it may be about $210 next year. Standalone prescription drug plans, not only, and this is premiums, there's going to be all kinds of changes to the formularies that have not been released yet. Those can run anywhere from $0 to $100 per year this year, and they won't be at $0 to $100 next year. I can say that much, but I can't get into specifics until October 1st. Medicare Advantage plans with prescription drug coverage. The premiums are usually $0 to $20 per month for most plans, but what typically happens is the out-of-pocket maximum goes up every year, and then some of the extra benefits like dental, vision, hearing, OTC cards, those type of things, those are being scaled back for this coming year, and the reason is that insurance companies and also doctors, their reimbursement, they're incentivized based on what's called star ratings, and most insurance companies have had a reduction in star ratings, so they'll get reimbursed less by Uncle Sam, and that reduction is being met with reductions in some of the extra bennies. There are also Medicare Advantage plans that don't have prescription drug coverage, and that's primarily used by veterans who have their VA, who are able to get their meds less expensively through the VA. There's also special needs plans for chronic conditions like the common ones are diabetes or COPD or similar things that are available in specific markets. And then those that are eligible for partial or full Medicaid, they can enroll in a dual plan, which may reduce their out-of-pocket expenses. Medicare refreshment, Medicare supplement plus Part D plan, age-based premiums, the advantages, low out-of-pocket medical expense. You can visit any doctor or hospital anywhere in the country that accepts Medicare with the Medicare supplement plan. If you want to go to MD Anderson, any of the top hospitals in the country, including Hawaii, Puerto Rico, and Alaska, not that they have top quality hospitals, but it allows you to see any provider in the U.S. who accepts Medicare. This is very important in rural areas because the ability to see top-notch hospitals in rural areas, the regional hospitals, the county hospitals they're in sad shape, and a Medicare supplement plan wouldn't enable you to see any doctor anywhere. Medicare Advantage plans, the benefit there are lower premiums, but you can have significantly higher out-of-pocket expenses, and you can reduce that if that concerns you. You can reduce that by marrying it up or including what's known as a hospital confinement plan that can provide a cash benefit in case of a big claim. If you get admitted or you have surgery inpatient or outpatient. These have geographic networks, so you're limited to the doctors that are in the network. 90% of the plans are HMO plans. About 10% are PPO plans, and the insurance companies I'll mention, they're making it very clear that they don't want PPO plans in markets across the country. And you also have to know that the providers get paid more to manage make it more difficult to see or to manage and reduce the cost of your care. Okay, prescription drug coverage. And part of this is the year 2 of the Inflation Reduction Act, the IRA. The maximum in 2026 that you will spend on drugs that are in a plan's formulary is $2,100 plus for all but the lowest cost generic drugs, there's a drug deductible of $615. But what's happened is that some of the cost of this, and this is a big number. Imagine somebody and I've had clients that are spending $20,000 a month on cancer meds that are not transfusion meds that are not covered under Part B. The insurance companies have had to suck up some of that additional cost, and that additional cost is passed on. So that is the reason for major changes in the 2026 drug formularies. They haven't all been released, and the insurance companies can change those drug formularies every quarter, but come October 1st, they're also supposed to be released, and next week I can start following up, and those clients who have completed their survey form, their secure and encrypted form, will be, I'll be working on those in the order I receive. Now, also, drug price negotiations. This is kind of interesting. These are the drugs that are subject in 2026 to drug price negotiations. And these are expensive ones. Even the bottom with only 31,000 people that it benefits, you can see the amount of money that it costs our country. So this is good. But again, there's more drug negotiation. There's supposedly a White House conference that will be announced next week as to what some of the additional changes are. So this is current as of 9/26/2025. One resource for you, and I can send you this list. This is a company called CanadianMedStore.com. If you're interested or haven't seen this, I can send you the PDF. This is the top 100 drugs in the country and what you would pay for a 3-month supply. And as you know, we don't have most favored nation. We end up paying more for meds, even though many of them are developed in our research universities, and that will hopefully change. Now, this is before tariffs. I actually met with the CEO of this company in Irving, Claudia Ramirez, who I'll introduce shortly. I met with him this week, and he made the statement that, he didn't see tariffs being an issue. And then, of course, yesterday came out that there could be tariffs as much as 100% placed on medications from offshore or from international companies that don't play ball. So that remains to be seen. But it's a pretty good savings, especially on the more expensive drugs. Now, not to get too morose, but these are and I'm bringing this up for a reason. First of all, I've experienced many of these myself. And I can tell you, I've had clients over the 22 plus years that I've been in this business that have gone through all of this and then some and other diseases. And so I have a wealth of experience, not only personally as an under 65 and as a 65 plus year old man, but I'm blessed to have the sensitivity to people that manage and live with chronic conditions. Now, I mentioned 100% tariffs on pharmaceuticals. We'll see. We'll see which pharmaceutical companies play ball. ABBA, the One Big Beautiful Act, will have some effect on Medicare. And then, of course, we have the federal budget negotiations and potential for a government shutdown, 10/1. Here's where that's going to impact Medicare. Medicare is considered an essential service, okay? But in the event that the government budget reconciliation, I say I have in quote budget because we haven't had a budget in this country for 16 years. It just keeps getting kicked down the road. But if we can't come to terms, the government will start reducing some portions of Medicare. The one that may impact you the most is being able to get Medicare cards replaced. So I encourage, and you'll see at the end, the summary, one of the things you want to do, if you can't get your hands on your Medicare card, or if you don't know how to log into Medicare.gov, boy, you better do it in the next couple of days. And they're open today. They're going to be open Monday and Tuesday. But if this doesn't happen, you're going to wish you could log in and that you have a copy of your Medicare card. Insurance companies and providers, I mentioned government reimbursements are getting cut. Also, even though Medicare Advantage plans may cover telemedicine, there is no, and providers may continue to offer it. Telemedicine won't be covered as of, I think, the end of October. Also, vaccines, with what's going on, it's question marks whether vaccines will be covered by, and that's from what I'm hearing, vaccines will be covered by insurance companies, but that's subject to change. Insurance company changes, market and plan withdrawals. Across the country, Minnesota, Kentucky, Texas, there are a number of companies that have withdrawn a ton of plans. Now, the thing that impacts all brokers is that commissions, not that there was ever very much, commissions are gone on Part D and also on most Medicare Advantage PPO plans. So that's not necessarily bad. There are good reasons to be on an HMO plan, but what the insurance companies are signaling when they do this is that, they want brokers to stop representing it. They want it, and as a result, there will be fewer members on PPO plans, and that usually signals that the following year PPO plans will be eliminated in that market. Market plan and withdrawals, qualifying for a Medicare supplement plan. If your plan, and if you don't have yet your annual notice of coverage document, you should receive it. It's supposed to be in your hands by October 1st. Check to see if your plan is being changed or being eliminated, because that would qualify you for open enrollment into a Medicare supplement plan. There are other options that are more affordable than a Plan G, which if you're 75, maybe I usually say at $300 per month in premiums for a Medicare supplement plan, or if you no longer are traveling or you're not really concerned about what doctors you see, you may want to consider a Medicare Advantage plan. But on the other hand, if you have chronic conditions or expensive out-of-pocket expenses and you're on a Medicare Advantage plan, if your plan is eliminated, that gives you an opportunity to enroll in a Medicare supplement plan. Okay, now, again, I mentioned loss of commissions, but I've always been someone who believes in doing the right thing. Okay, and I am not offering less support. I'm offering more support, but I have to change how I operate. Claudia Ramirez, who I will hopefully, I will put you on to introduce yourself in a second. But Claudia has been my right-hand person for more than a year now, and she recently received her license, and I'm mentoring her, and she is awesome. She's bilingual. 40% of Americans in Texas, and I'm not just I'm talking about overall population. 40% of the people in this state, and in many of the southern states, and even Chicago, Colorado, etc., English is a second language. I've also have a full-time support person, Wiley Bouillard, who is also bilingual. She would be here, and I'll introduce her next week. She is here to support Clau and I and to answer calls, and also have a new, more user-friendly website, which is still being expanded. Every time I've been sending an email out, I personalize it, when many of the things should be put in a website for other people to benefit from. So there will be that. All of the links and the secure encrypted forms will be on the site, and it will be more user friendly. The secure and encrypted form. I can no longer request that you email your doctors and meds information for compliance purposes. So I'm asking you to, if you haven't already, and boy, close to 100 clients have already completed the form for Medicare, and it's available in English and Spanish. Once you complete that form, beginning October 1st, Claudia and I can go to work in terms of making plan comparisons. I will be the one going through them for you and sending them to you, but we'll be sending them out beginning October 1st in the order that we receive them, with the recommendations and then a calendar appointment. By your completing this form, and also I'm going to be, and this is a very hard habit to break. I love talking to people. If you haven't noticed, I love chatting and getting to know you and you getting to know me. It's a highlight of my day and week when I can help somebody every day. And Claudia shares that same spirit. But beginning next week, it's nose down. So I'm asking you to understand when my voice, when you hit my voicemail, there's going to be certain hours of the day when it goes to voicemail, and then I'll follow up with you later in the day. The reason being, imagine getting 50 calls a day from people wanting to give me their prescription information or asking questions. It leads to total distraction. So I'm going to be trying to break a bad habit, but I've always tried to be as super responsive as I can, but there's limits to that. So don't be surprised if you hit a voicemail. Now, the secure and encrypted form, Medicare form, many of you have gone through that. It's safe and secure. It's going to save Claudia and I about 20 hours a week of taking information from emails or by phone. And that gives us more time to prep homework in terms of recommendations and plan comparisons for clients, and also more time to discuss with you the recommendations and why this is in your best interest based on experience and knowledge and things that would take you forever to figure out otherwise. There's also a similar form if you have a spouse or if you have children or friends and neighbors that rely on healthcare.gov. There's a similar form for healthcare.gov plans and also alternative plans. It's safe, it's secure. The open enrollment period for these plans is November 1st, a month later, so they overlap with the Medicare open enrollment. And this year it is September 26th, so this is like 5 weeks away. There is no resolution as what to the rules of the road are in terms of the plans, the premiums, the premium tax credits that are available between the administration and congressional gridlock, the Supreme Court challenges that will probably end up in the Supreme Court, and then of course the budget reconciliation. It may be November 15th before this is settled. Hopefully not, but I'd be trying to be realistic here. There's also one for life insurance. I've never really pointed up the fact that I'm one of the top life insurance brokers in Texas because I focus a lot on Medicare and individual health plans for people under 65. But, everybody needs to have some form of life insurance. No matter how sick or frail or old you are or healthy you are, there's a life insurance plan for everyone. Okay, client support. This is my reminder. I've already covered it. Office hours to return calls. Now, there's also a new tutorial on how to enroll in standalone prescription drug plans at Medicare.gov. And I'm going to go through that for a second. But on November 1st, because, I've, I don't know, somewhere about 500 clients or possibly more in healthcare.gov plans, that, once it is resolved what the rules are, everybody, there's 18 million people, and I've got a good chunk of them in Texas. They're going to be their world's going to be rocked because they may be facing increases as much as 40 to as much as 70%, depending upon what gets resolved by the powers that be. And also be talking more about life insurance, short-term care plans, with whether you're living alone, whether you have a spouse or a partner, or relying upon a relative or someone else. A short-term care plan can provide up to 6 months of living expenses. So say post-surgery or after something major, can provide the funds to have anywhere from somebody to come in and help cook and clean and household chores to a visiting nurse. And then also, because of the changes here and loss in commissions, I am going to be asking more than in the past for new client referrals. May seem kind of contradictory given these changes in my support, but I want you to know I'm committed to providing overall better support, but I do have to change how I operate. And, I don't mind telling you I'm age 71, and while I love doing what I do, I'm passionate about it. This is also not a nonprofit organization. Now, how to self-enroll in Medicare Part D? Let's see. I am going to cover that at the end, and I'll go through that. But that's going to show you how to enroll in standalone Part D prescription drug plans at Medicare.gov. This is one of the reasons why you want to make sure you have your Medicare card number somewhere. You don't need your card, but you sure need your Medicare card number. And if you haven't set up or you're not sure of your account, you'll want to set that up. And again, November 1st, Claudia and I will be focusing on Medicare clients and really hitting it hard. You've got three people working on this. Claudia and I are licensed, and so you've got more support. But I do have to change how I operate, and hopefully you understand. Now, I've covered a lot of that. Next webinar will be the same time, 11 to 11:30. You're going to see the link to this recording. You'll get the link to this recording by September 29th, and then next webinar details and a follow-up email. Now, I talked to you about my homework. Here's what I'm asking you to do. Register, make sure you have your Medicare.gov account. Do that now in case of a potential government shutdown, because you won't get nearly as much support as people start realizing, hey, I better do this. You can call 1-800-Medicare. If you can't log in, you can always enroll by phone at 1-800-Medicare, but it takes longer. Please complete your secure and encrypted form. I'll be working on that in the order I receive them. And then watch a tutorial, which will the link will be in the follow-up email. And I'll also post it to the MedicalInsuranceExchange.com website. And anybody on Medicare or any form of individual insurance, if they're under 65, boy, I tell you, this is the most change in the last 25 years in healthcare. And forget inflation. Healthcare inflation is running at the rate of 10+% a year. This is changes on the overall scope of things. Medicare is an awesome benefit that we have paid into, and it's important that Medicare Trust Fund stays solvent, and it's which will mean more taxes and more support by people younger than us. But it's an awesome benefit. So, but if somebody expects that life is going to be the same in 2026, they couldn't be more wrong. And boy, they may find themselves in a bad situation if they don't take notice. I've talked about all this. That's really what I wanted to cover. I'm going to now go to, let's see if I can do this. And it's, hold on one second. I hate it when this happens, but I will edit this out of the follow-up. So just give me a second.
While you do Mike, I'm just gonna, hi everyone, I'm Claudia Ramirez. I'm here to help you. Whatever you need, if Mike cannot pick up the phone, I can pick up the phone for him and help him out. I just posted in the chat the links that Mike put on the presentation so you can have them. Also, if not, the Medicaid survey, you can go there. It looks a little bit different than the one that Mike put on the presentation, but it's exactly the same link. All the information goes there. So I'm going to put right now the office phone number. If you want to receive it directly to your phone, the survey, you can go in and put the extension 4. I'm going to put it here in the chat also, so you can have it at hand. You can call the phone number and you can go for 1 for English, 2 for Spanish. And then if you go to extension 4, you'll have the Medicare survey directly texted to your phone. Extension 5 to ACA or Obamacare, extension 6 for life insurance. I'm putting all the information here in the chat so you can have it handy. And well, I'm here to serve, so I'm glad to meet you all. And whatever you need, we're here for you. And like Mike says, like he really enjoys talking to all of you guys. He loves you all. He always talks great of all his clients, and he's always happy to receive your calls. So if he cannot pick up immediately, he will get back to you. Thank you.
Claudia, can you see the screen?
Yes.
Okay, great. Thanks, John. All right, so let me play this, and it'll be posted. You won't believe how easy this is, But you're still going to get the recommendations. But I'm asking you for the benefit of everybody, since everybody needs to really check if you can, to please self-enroll. It's super simple if you have your Medicare card and you have access to Medicare.gov, or you can call the 800 number. So here we go.
This tutorial guides you through the process of self-enrolling in Medicare Part D. You will learn how to securely log into your Medicare account, update your medication list, add preferred pharmacies, and search for suitable Medicare Part D plans. Before starting, ensure you have your Medicare login credentials and a list of your current medications ready. Click the Login area to begin your Medicare Part D self-enrollment process, starting your secure access to your account. Select the option to save your username for next time to streamline future logins. Fill in the username field with your Medicare account username to identify your profile. Enter your password securely to authenticate your access to the Medicare portal. Click the Login button to access your Medicare account dashboard. Open all available options to view the full range of enrollment features and settings. Select Update My Saved Drugs to manage your current medication list for plan comparison. Click Add a Drug to include a new medication in your saved drugs list for coverage evaluation. Begin typing the name of your drug to find and select it from the Medicare database. Enter the name of your medication, such as atorvastatin, to add it to your drug list. Click Add Drug to confirm the addition of the selected medication to your profile. Click Add to My Drug List to save the medication for plan matching and cost analysis. Start a new plan search to find Medicare Part D plans that cover your saved medications. Click Add Pharmacies to include preferred pharmacies for your prescription fulfillment. Click Basics to review fundamental information about Medicare Part D coverage. Explore resources such as Medicare costs, rights, and fraud reporting to stay informed. Click Log Out to securely exit your Medicare account after completing your updates.
Okay, I'm back into my healthcare.gov account, and here's the same pharmacies that I picked earlier and my zip code. And this is a plan that I'm on. I'm just going to pick another plan for comparison. All right, here's the WellCare Classic plan to compare with the WellCare Value Script. And this is 2025. This will all change come October 15th. You'll be able to then click compare, and if there's a better plan for you, and when I say better, that's you will have received my instructions on which plan is the best in terms of total lowest cost between premiums and the meds that are in a plan's formulary, and then all you have to do is click the enroll button, and it's that simple. Thanks very much. I appreciate your watching this video. Thanks for watching this how-to video. And remember, 2026 open enrollment that begins October 15th for Medicare recipients and November 1st for individuals relying upon healthcare.gov or state-based exchanges. This is going to be a very, very challenging open enrollment period. Many of the rules and guidelines, especially for Obamacare, have yet to be decided upon. What that means is everybody needs to or must check their coverage because there is no status quo for next year. And there are a number of, unfortunately, very bad actors out there that are preying on people that work in call centers and are slamming people into the wrong plan. I've always believed in support and doing the right thing. I'm asking for your help in order to spend more time with you and time with clients developing the recommendations on what to do. I'm asking for your support to please complete the survey forms and also to self-enroll in Part D. And by following step-by-step this how-to video, that'll go a long way. And I also ask you, everybody has friends, neighbors, and relatives that may think, no big deal. Well, it is a big deal this year. This is one of these years that is really unprecedented. I've been in this business a long time. You need to warn your friends, neighbors, and relatives that this year is unusual, and to be aware of all the bad actors out there. I'm more than happy to help people that are able to that are able and willing to seek support from ethical brokers. If not me, I can recommend others, but I welcome your referrals. Thanks, and have a great day. Claudia, any questions in the chat?
Yes, Mike. You mentioned that we should have gotten something in the mail from our current Medicare carrier. What was this?
Good question. It is in the mail. They're all supposed to arrive by October 1st. It's called an annual notice of coverage, and it's an excruciatingly detailed, confusing document that includes everything about your Part D plan or your Medicare Advantage plan. ANOC is the short acronym for it. And unfortunately, there's a lot of bad actors that send out junk mail that look identical to it. And so a lot of people, including me, that get bombarded this time of year with Medicare mailings and spam and robodials and that kind of thing, they just deep six it and circular file it. You want to look for something from your Part D company, whether it's WellCare, United Healthcare, Humana, Cigna, you name it. And you will see in that all the changes. And that change may say your plan is no longer available, or you're going to be moved automatically into another plan if you do nothing, and you're going to pay more. That's why you want to look for that document. And then come October 1st, we can start doing, if you complete the form, we can start on the homework and be prepared to discuss the best options. And then you know, with a few clicks, if you have access to your Medicare.gov account, you'll be able to self-enroll.
There's another question here, Mike. Dwight Sandel, this is my introduction to you. What is your fee schedule for comparing supplement versus Advantage plans? I'm enrolled in a Part G plan, but want to consider Advantage.
Okay, fee schedule. I'm a commission-only broker. You pay nothing more or less than you would otherwise, if that was a question. As far as what is the difference, Medicare Advantage, my rule of thumb is, and I have clients that for one reason or other stay on, they're paying $500 or more a month for a Medicare supplement plan. But why are they doing that? Well, maybe inertia. It might also be because they want to see any doctor in the country, or that maybe they're living in a vacation home somewhere, but their home is in Austin, Houston, or Dallas, or Georgia, or Florida, where I'm licensed. There's flexibility that may overcome the cost of a Medicare Advantage plan. Most Medicare Advantage plans have a higher out-of-pocket medical expense risk, but they also, Medicare Advantage plan is the choice. So I'll shut up and listen. About 60% of all Americans have a Medicare Advantage plan, but that doesn't mean it's necessarily the best. It's what they were presented when they first turned 65, and now they cannot or have never heard of a Medicare supplement plan. So there's benefits of both. If the cost of a Medicare supplement plan has become prohibitive due to fixed income or no travel, by all means look at it. But generally, I recommend, at least for the first year, going on to a Medicare supplement plan when you are eligible for Medicare, and then consider a Medicare Advantage plan if you want to for cost. Long-term Medicare supplement plan with you paying premiums will more than compensate. And I can show you the numbers. What you pay in premiums is offset by what you would save in medical expenses, plus the ability to see any doctor in the country. But at some point, inflation. I mentioned 10% plus for for increases in healthcare. That gets passed on. Part B premiums are going up. Medicare supplement plans are going up. Medicare Advantage plans, the premium may not go up, but the out-of-pocket medical expense risk and some of the extra benefits like dental, vision, and hearing, which are pretty cheap benefits that are, touted by Medicare Advantage plans. At some point, the pendulum swings that at $300 or more, you might want to consider a Medicare Advantage plan. That probably is more than you asked for, but feel free to ask a follow-up question or ask an additional question.
Charlene is asking, is the annual of coverage from Medicare or from our coverage plan, Humana, Aetna, etc.? I didn't quite understand that question.
Yeah.
And there's some people saying here, Mike, that they will be happy to pay you a fee if that was even legal. I will happy pay a fee based that I did understand the commission only. I understand your passion to help, but if I ever need to pay a fee for your service, I will be an active contributor, Mike. You've helped me as I care for my mom more than you know. Blessings to you. So just wanted to share those comments.
Thanks.
That
I can't tell you how much that means to me. However, it is illegal to accept for any licensed agent. I know many that bend this rule. There's many bad actors, unfortunately, but no licensed agent is permitted. It's, they lose their license to accept it. And there are unlicensed people, and some work for nonprofits. Some just use it as a way of supplementing their income by going around and presenting options to people. If they're unlicensed, they are not permitted to do that. Licensed agents, we go, just so you know, I've started certifying, first of all, for Medicare, and that takes roughly a week to go through that every year. And then I have to certify with each insurance company, and that takes at least a day for each insurance company, recertify for the upcoming year. And because of the changes, there will be added certifications, between now and October 15th that we go through. You don't see that, but that's one of the things that keeps me up to date. I also follow all the healthcare trends and what's happening in Washington and Austin and, in other states to be able to present factual information. There's the concept of fake news. Well, there is so much fake news and bad information. I've never taken a political position. I believe in the Jordan rule. Michael Jordan, who said, he asked why didn't he ever contribute to a political cause, and it's because you're going to lose half your audience. So I present the facts. I know my stuff, not only on a professional level, but as a person who's on Medicare and has been through, health conditions. I have sensitivity and empathy for everybody, regardless of your age.
Mike, there's another question here. Is this possible to change your Medicare Part B supplement provider during the open enrollment period? Or do you have to stay with the one you originally selected?
Medicare supplements. Okay.
Part D, he was talking about, or she was talking about Part B.
Okay, Part D is in dog or
B
drugs?
is in boy.
Oh, Part B, if you have to always pay your Part B premium unless you're Medicaid eligible. Yeah, so that 185 may go to 200. There's no changing that. You buy that from Uncle Sam. And if you were not to pay it, and sometimes things happen, people forget to pay, or they haven't set up auto pay, or they have set up auto pay and then there's no insufficient funds. Well, if they lose their Part B, then they have to start all over again and pay a penalty for the rest of their life. But there's no changing Part B as in boy. Medicare supplement plans cover everything that the 20% that is not covered by Part A and Part B.
Okay, I think they correct themselves. I'm asking about the supplement, like could I switch from Humana to Blue Cross, for example,
Sure. Well,
during open enrollment?
Sure. You can go through an underwritten application where you answer medical questions, and depending upon your answers, you would, during the underwriting process, you would be approved by another plan. Also, if you are on a Medicare Advantage plan, and your plan goes away, you can qualify for a guaranteed issue open enrollment. But if you're on one Medicare supplement plan and you have a significant health issue, or you're on an expensive medication, you probably would not pass underwriting, or you'd pay a whole lot more.
Okay, I still have that one question about the what was it, the annual change of coverage?
Mm-hmm.
Does that come from Humana, or does that come like for Aetna, or does that come from Medicare?
Yeah, that sounds like Tara Lynn. I've recognized her voice, Tara Lynn.
Yes, it's me.
Good question. Well, the answer is it comes from your Part D company if you have a standalone Part D plan, or if you have a Medicare Advantage plan, it comes through your Medicare Advantage plan company. But we all get so much junk mail this time of year. It's very easy to pitch that, and everybody's supposed to receive it by October 1st. So I'd be checking the mailbox for that annual notice of coverage. Now, I also have to tell you, it's kind of like reading all the tax, at tax time, trying to do taxes yourself. It's very complicated. It's a legal document that's over 60 pages long, but it goes into detail. It won't say how much you're going to spend for, let's say, gallbladder surgery. That you have to ask for your provider, but it will cover in detail what the copays are, what the out-of-pocket expenses, what the prescriptions, or the link to the formulary that will be available come October 15th.
Awesome. Thank you.
You bet, Caroline.
There's another question here, Mike. There are a few questions as we enroll that is from Alan Costello. There were a few questions as we enroll that we didn't understand. Hopefully we can change things that we misunderstood after speaking with you.
Yes, and that's, thanks, Alan. That's why I'm doing these webinars, to be able to help raise the understanding, and not that you're going to remember this all through the year, but to explain things. Yeah, this open enrollment period, any changes would go into effect January 1st, 2026, provided you change your Part D plan during open enrollment that begins October 15th.
And if you already did the survey and you need to redo it, the information will be automatically updated to our system. So if you didn't understand what you were doing during the survey and you need to add more medications or more doctors, you can redo the survey again and it will just be updated to our CRM.
Yeah, you can't add a doctor, okay, or a prescription. You've got to start from scratch. So that's why it's good to make sure you've got everybody to start with. But yeah, you just put it all in there, and that wipes out the one you've already completed.
So, Mike, this is Donna Culliver.
Hi, Don.
How are you? So if I was online and I was completing the information that you had asked for to get in line to have you review things, and I had gotten all the way to the end where I was putting in all my doctors and hospitals, and I had a doctor call and I had to switch over, and I guess we were on too long or whatever, I don't know. But when I went back, it had taken me out. So then when I tried to go back in, it looked like it was going to make me start all over. Does not any of that save?
Yeah, unfortunately, that's something that Center for Medicare Services controls for security, cybersecurity. Somebody walks away from a computer for half hour or so, and in the meantime, somebody's looking at what you've completed. So they control that. You would have to start over, Tom.
Yikes.
Yeah.
So
Okay, and that's just the one to get to you, right? So I
That's
can,
right. I can't ask for it, anymore by phone or by email.
okay.
and we do recommend that when you're gonna go through the survey, have all your medications, prescriptions, doctors, pharmacies, everything with you, so you can just put in information like in an easy way for you, and you don't have to go back to redoing it if they just kick you off because
Yeah, I've got it
you.
all lined up on the
Yes.
table, and I was at the end of my doctor's.
I'm
And
sorry
I was
for
like,
that.
oh no, how do I save this and get out and answer this doctor call?
Yeah.
But okay, well, I just didn't know because I thought, do I start all over again?
Yeah, unfortunately, it'll be easier. We're all going through this adjustment, so I'm asking for your patience going through this. Some of this I can't control, and well, I'm not sure I mentioned this. Every inbound and outbound call now has to be recorded, and I have to store it for 10 years. So I guess that means I'm going to be around till I'm 81 at least, because if I ever have a complaint against me, the first thing Center for Medicare Services is going to ask for is every phone recording. So I ask you to call on the office number 214-764-6315. My extension is 1. Claudia's is 2. Wiley's, who could not be here today, is extension 3.
Your extension too?
I'm Claudia's extension 2, Mike is extension 1.
Okay,
Yeah,
thank you.
you're welcome.
Y'all have a blessed day.
You all do have a nice
Thanks,
day
Donna.
too.
Thanks for all you do, Donna.
I've been sending people your way, but
Well, thank you, and God bless you for what you do.
thank you.
Are there any other questions? Mark Reynolds said that he was from Walker and was called annual notice of change. I think this is information for Terline, that she was asking about something about the annual notice of change.
Oh,
That's the way it was called.
Yeah, it probably just showed up.
Mhm.
Yeah, and if you haven't got it, it should be in the mailbox today or this weekend. All right, I'm going to wrap it up, and thanks very much. I'm here until 2 p.m. To answer questions, so personal questions. And thanks a lot. I'll edit this down so it makes it easier to go back and pick up some things. And again, thanks for being here, and I look forward to talking to you, as does Claudia. Claudia's awesome. Just so you know, she's a college graduate. She has been a personal friend and wife of one of my very best friends. And she's been helping me behind the scenes. She's smart. She's bilingual. She's a college graduate. And she has that same passion to serve. And I'm so blessed to have her and to be able to mentor her. And as she progresses, she'll have a great career ahead of her, no matter what the changes are. If you stay on top of the stuff, and there's always the ability to solve problems and serve people. All right. Thanks. And have a blessed day and weekend. I look forward to talking to you.
Bye. Thank you everyone for coming. Bye.
And of course, you're going to get recommendations from Claudia and I as to which plan is going to have the lowest total cost for your medications if you complete that survey or that secure and encrypted form. So all you'll have to do is click enroll, find the plan, find the whether it's Part D or Medicare Advantage plan. And then what you want to do is search by carrier, health insurance carrier, and locate the plan by name. And then you'll see it and then enroll in that plan. It's as easy as 1, 2, 3. And your medications, other than new medications, will already be loaded into your Medicare.gov account as long as you used your Part D plan for those medications. 2026 open enrollment that begins October 15th for Medicare recipients and November 1st for individuals relying upon healthcare.gov or state-based exchanges. This is going to be a very, very challenging open enrollment period. Many of the rules and guidelines, especially for Obamacare, have yet to be decided upon. What that means is everybody needs to or must check their coverage because there is no status quo for next year. And there are a number of, unfortunately, very bad actors out there that are preying on people that work in call centers and are slamming people into the wrong plan. I've always believed in support and doing the right thing. I'm asking for your help in order to spend more time with you and time with clients developing the recommendations on what to do. I'm asking for your support to please complete the survey forms and also to self-enroll in Part D. And by following step-by-step this how-to video, that'll go a long way. And I also ask you, everybody has friends, neighbors, and relatives that may think, no big deal. Well, it is a big deal this year. This is one of these years that is really unprecedented. I've been in this business a long time. You need to warn your friends, neighbors, and relatives that this year is unusual and to be aware of all the bad actors out there. I'm more than happy to help people that are able to that are able and willing to seek support from ethical brokers. If not me, I can recommend others, but I welcome your referrals. Thanks and have a great day.